Hey, it's your girl Brooklyn Stacy, and welcome back to my channel, everyone. And today we're going to be taking a closer look at, yes, vaginal pH strips. This is for feminine care, so this is geared more focused for the ladies. To my sisters out there, as we do need to be in tune as to what's going on with our bodies and always be aware of signs and symptoms, and so that we can make sure that we take care of ourselves and make sure that we can monitor ourselves at home, so that when we do go into our provider, we will be able to help our provider all that much more to help diagnose and treat us as well. This is not only for women, this is for men, because men, hey, if you're involved with a woman, want to be involved with the women, care for a woman, you need to know these things too. This is education for men as well, so that you can understand what women's bodies we do go through, and then you can be aware of some things as well and be able to help that particular woman. Okay, so let's go and take a look at this. This I did get off of Amazon. I'll leave the link as to where you can get these pH test strips as well. Okay, so I wanted to take a closer look at the symptoms chart so that you would know how to use it and how to guide it. I think this is really great that it does come with this, because it does help you. It's in kind of small fine print. I'll try to get it up a little closer so you can see that it does have on the top here, it has the vaginal pH, and depending on what result you get here, what it could possibly be. As you can see here at the top, it can be from a urinary tract infection. It can be anywhere from streptococcal infection, trichomonas yeast infection, or candida vaginitis, or bacterial vaginosis, other known as BV. And then also you can check the little check off column here as to the actual symptoms that you may be having with the symptoms checker. So it can be anywhere from itching, redness, and or soreness. It can be anywhere from the discharge that you're having, and then you can do the little check off thing here, as well as to anywhere from any type of odor that you may be having, and just go down the list to see what the possibilities are. And this will give you a good guide as to what it may be, so that, you know, once you do check the pH, you can match it up against the symptoms that you are having, and then discuss it with your healthcare provider for the best treatment option. Okay? And so this is really good, especially if you're doing a over the phone or virtual visit, instead of going into the doctor's office, as a lot of people are doing at this time, and a lot of insurances are offering the virtual visits. So this will be helpful to the healthcare provider that you are speaking to. So along with the instructions, I wanted to just go over the testing, the actual testing. And this is really good because it tells you when you should test your vaginal pH. It, tells you how to perform the vaginal pH test. It has the great color indicator here, which is also located on the side of the bottle here with the actual values as well. So you can match it up to using this, or you can match it up using the insert, the color insert. Okay, so and then it talks about the factors that may increase your vaginal pH, and different vaginal infections that may increase your vaginal pH as well as it gives you what the healthy range is and what the unhealthy range is. So this is really a great educational insert that they include there that can help you be reassured And then, on the flip side, it talks about, like I said, when you should test your vaginal pH, the reasons you should test and how accurate it is, and certain tips to maintain a healthy vaginal pH. All right, so now let's get into the actual testing and the using these pH test strips. Okay, so it does come with 2 of these packages, and there are 50 test strips. As you can see, I've already opened one and taken one out, and there's one that remains in there. And then also, once you remove one of these strips, here's your indicator strip. You can see it up close better. It's just a square, small indicator strip. So what you would do is, of course, you want to make sure you wash your hands and have clean, dry hands. You will use a clean cotton swab. So I have, something like a Q-tip, clean Q-tip for this particular test. And you would just hold the swab handle between your thumb and your forefinger. And you would take the cotton swab, and then you would insert the swab, and you would tilt it so that the swab comes in fully contact. You would swab for about 5 seconds, and then you would remove the swab, and be careful not to touch it with anything. And then you would take the test strip here, and you would firmly rub the cotton swab on the pH indicator here of the test strip, and then wait for about 15 seconds. Okay, and then after 15 seconds is up, then you would take either the color indicator here on the container, or remember, you have it in the instruction pamphlet, whichever one you feel more comfortable with. This is larger and easier to see, but it's up to you. After you waited for the 15 seconds, you would then use the color indicator and take your test strip and simply just match it up as to which is the closest in color, and then you can get your result from that on whether it's a 3.0, which is acidic, whether it's normal between 4.0 and 4.5, whether it's on the abnormal side. Okay, so then after you have your result as to what color it is, then you can go back to your symptoms checker. And remember, here with your symptoms checker, it does have the different pH numbers. So based on what number you did get from your color indicator here, let's say for instance it's a 5.0. And if it is a 5.0, then you would say, oh, okay, so it's greater than 4.5 for bacterial vaginosis. It's greater than 4.5 for trichomonas. It's greater than 4.5 for group B strep, or it varies for a UTI, urinary tract infection. So you know that it can also be a yeast infection because that's up to 4.5. So now what you would do is now then go down the list to say, okay, what are my symptoms? So you can see what it possibly will be and what it may not be. Okay, so that gives you more of an indicator versus you guessing. And like I said, you would talk that over with your primary care physician, and they can, pretty much narrow it down a little bit further. So that's it. And that's what I wanted to, show you guys. And again, this is not just for, even though this is about feminine care, men, you can definitely stand to learn some information as well, because, you need to educate yourself about what goes on in a woman's body, and you need to educate yourself about the different possibilities that it can be, and not always assume what you think it may be, because what you think it may be may not actually be that. As well as women, what you think it may be may not be that, and you're treating yourself and you're not giving yourself the best possible treatment out there, or you need to know when to go to your provider. So this would be very helpful for women and men as well, when it comes to feminine care. And, the men can maybe make suggestions or help the woman that you're involved with or that you care about. And you can just go and pick one of these things up. I'll leave the links on in the description box. If you like what you saw, please do give it a thumbs up. This is, and make sure you share this. Things like this needs to be shared to women and men as well, so that you would know what's going on in your body. Young women, older women, just women of all ages, so that you would be educated on feminine care and vaginal health. Okay, so hopefully this helps someone. Like I said, don't forget to share. Don't forget to give this a thumbs up. Drop your comments below, and also subscribe to my channel. Don't forget to visit our sponsors, the I'm So shirt, and check them out. And as always, thank you so much for watching. Take care and be well. Bye-bye.